Good afternoon. My name is Alan Pitt, and I'm here to talk to you about Healthcare Pittstop, a new platform for conversations in healthcare. But before I do, I thought I'd tell you a little bit about what drives me and why I started this new platform. I'm an attending physician at the Barrow Neurologic Institute, a large center of excellence in Phoenix, Arizona. I specialize in neuroimaging, looking at the brain and spine for the neurologists and neurosurgeons that work here. My path to this job has been anything but straight. Like many pre-medical students, I started out doing medical research early on in high school. I did some orthopedic work looking at how to build better orthopedic implants. This migrated over to cell biology. At the time, I thought I wanted to be an oncologist, and so I spent considerable time looking at molecular biology and genetics back in the 80s, which seems like forever ago. However, my attention was then grabbed by the neurosciences, and so I moved over to neurology and then later to neuroimaging and began working in that space. My timing in radiology was good. The transition from film to computers in medicine to digital imaging was just occurring during my residency, and I was able to take advantage of this and learn a lot about health IT and computers in medicine. And this afforded me the opportunity to sit on some of the different committees and meet many hospital administrators that I might have not been exposed to early on in my career. I just took this early experience in imaging and leveraged it to begin thinking about problems around how could we make patients and providers come together, leveraging, still providing some level of intimacy and privacy. This later led to my role as the Chief Medical Officer of Avizia, a global telemedicine company based out of Virginia. Along the way, I've also been an entrepreneur. So I've helped something like 6 different companies in various capacities figure out, did they have a solution in healthcare, and how would providers and other folks respond to this? This gave me some access and some learnings from the equity markets, both venture and private equity. And this was also a very interesting experience. Then several years ago, I unfortunately got to be on the other side of the healthcare wall. My mother fell off a horse and became a quadriplegic. And so I got to be something of a consumer in healthcare, a patient's family member. And frankly, my experience with my mother taught me that we have a long way to go to build a healthcare system that we can all be proud of. For the best country in the world to take care of people the way we do, it just doesn't seem right. I don't think that physicians, nurses, hospital administrators, even folks in the insurance industry, if you really talk to them, are happy with the way that healthcare is going today. So we still need to make some major strides. Several years ago, I started a blog. This was my attempt at putting my thoughts to paper, but this is really a one-way conversation. I would send something out and occasionally get comments back, and this was not as gratifying as I had hoped, although I plan to continue blogging when the mood suits me. Healthcare Pittstop is an attempt to have a conversation, have a two-way interaction with thought leaders in healthcare, to ask them what motivates them, what problems they see in healthcare, and what solutions that they might offer. Each one of these sessions, I'm hoping, will be roughly 10 minutes. I don't have that much time, and I'm sure you don't either, so I thought that that would be a reasonable time frame. Once the interview is done, I'm going to post them as videos, as podcasts, and as blogs, so that you can review them in any way that suits you. I hope you'll consider participating in Healthcare Pittstop, either listening in or potentially offering suggestions, ideas, or potentially people that I might want to have conversations with. Healthcare needs a lot of help from all sectors. This is one attempt to break down the silos of these various different sectors so we can build better solutions together. Thank you very much.